have to be done.
Thanks, bud. So good morning. I'm pleased to stand before you all today with Secretary Sudders, Commissioner Bharel, and members of our opioid working group to unveil additional legislation aimed at combating the opioid crisis plaguing the Commonwealth. As you know, our working group released a total of 65 recommendations in June to address prevention, education, intervention, treatment, and recovery issues. This includes short and long-term action items that will be implemented over the next several years. Today, we'll be outlining additional recommendations that require legislative action to continue our fight against this epidemic. Our administration's already implemented numerous recommendations, allocated $114 million in our budget to spending on substance abuse, have engaged the provider community, health plans, the deans of our medical schools, and other community members and interested parties in a variety of initiatives, increased the bulk purchasing of Narcan from municipalities, have required stricter reporting requirements for the prescription monitoring program. This legislation brings many important reforms to the fore, ranging from a new curriculum designed to educate student athletes on opioid use to amending the civil commitment statute to improve patient treatment options. Secretary Sudders will go into more depth in a few minutes, but I'd like to zero in on two provisions, both addressing a critical 72-hour period that will change the way providers prescribe medication to patients and the way we approach treatment for substance abuse problems. First of all, our legislation will limit the prescribing practices for first-time opioid prescriptions to allow only a 72-hour supply of medication, with few exceptions. For the past 2 years, I and many others have listened to far too many stories of people who come home from the doctor's office, the dentist, or the hospital with 30, 40, 50, 60, 80 tabs of all kinds of opioids when a handful would do. This has got to stop. And I appreciate the fact that this is a controversial idea, but it's one that needs to be part of the larger conversation about how we prevent additional addiction on the front end. There's a difference between acute pain and chronic pain, and the prescribing practices and the rules of the game associated with that need to acknowledge it. This means the first time a doctor prescribes an opioid prescription, when you visit a new doctor, he or she will only supply you with a limited quantity. You can always, as a patient, go back to discuss additional options after that 72-hour period. But the days of people walking out of a dentist's office or a doctor's office with 30 or 60 or 90 days worth of this pain medication need to come to an end. The Mass Hospital Association has already started to encourage emergency rooms to limit opioid quantities for just this reason, to prevent overprescribing practices that have in many cases led to drug abuse and addiction. And according to a recent study by the Harvard Chan School of Public Health that was published in the Boston Globe, only 36% of adults in Massachusetts said they were warned about the dangers associated with painkillers by their prescribers, while the same survey noted that 61% of respondents nationwide said they'd been cautioned. Second, this legislation proposes an additional way to approach treatment and creates a new pathway to help patients access the support and services they need. This bill will grant medical professionals the authority to involuntarily hold patients for 72 hours if they pose a danger to themselves or others. Right now, someone suffering from substance abuse disorders can only be held for treatment through a court order And those orders must be granted while the court is in session, and it prevents people from seeking help on nights, weekends, and holidays when the court is not in session. This limits access for families and patients in need of a 24-hour front door to treatment for substance abuse emergencies, and we want to change that to get more help to people faster. The provision parallels an existing law under Section 12 that permits a 72-hour period of involuntary treatment where a physician determines that a person suffers from a mental illness and poses a serious threat to themselves or others, an immediate serious threat to themselves or others. I've talked to many people in the Commonwealth, moms, dads, brothers, sisters, friends, neighbors, who've spent many sleepless nights trying to help a family member or a friend deal with addiction. And this pinballing in and out of the ER without any opportunity to really calm somebody down and have a conversation with them about extended treatment is usually one of the issues that comes up most often. I had a chance when I was campaigning for governor to sit down in Fall River with Chris Herron. As most of you know, Chris Herron is one of the best basketball players who ever came out of the Commonwealth of Mass. He also spent years battling a brutal addiction to opioids and painkillers. He said to me during one of our conversations that during one trip to the ER, when he was on the verge of death, some friends of his made a decision to simply hold him in the hospital long enough to be able to talk to him about getting into treatment. Now, he said that particular decision had an enormous impact on his ability to recover, pull himself together, and become, frankly, one of the leading speakers around the country to young people and others about the dangers of opioid addiction and painkillers. That's 72 hours. That 72-hour period is an opportunity to help folks find their way to a better path. And I get the fact that this is also a reasonably controversial notion, but it's a conversation worth having. And having spent a lot of time talking to a lot of people who've been personally affected by this, I think it's the right thing to do. Our mission as an administration is to use a comprehensive and all-encompassing approach to create new pathways to solve these problems, ranging from the education of our kids to reforming recovery services and providing additional support to those who offer those services to those with addictions. It's not going to get better overnight. I've said many times that I've never seen anything with the kind of negative momentum that this particular issue has. When you think about the fact that we've tripled the number of people in the past 4 years who've died of an opioid overdose, in the short term, the goal here has to be to disrupt the trend, get people to pay the kind of attention to this, whatever their station in life and their role in all of this, and to create a greater and more significant and sustained public focus on the prevention, education, intervention, treatment, and recovery options, then it can help us battle this epidemic. We're looking forward to working with the legislature on this. There's a tremendous amount of interest in this issue in the legislature. The House has passed a bill that's currently in the Senate. The Senate's passed a bill that's currently in the House. We hope that some of the elements of our legislation can become part of that discussion, and that they and we can move quickly to continue to enhance the Commonwealth's toolkit with respect to dealing with this terrible epidemic. Now I'd like to turn the podium over to Secretary Sudders.
For those of us who need the bigger print here. Thank you, Governor. I want to thank the members of the working group who are here today. As the Governor said, this legislation builds upon the recommendations made from the working group convened last February. We are focused on implementing multi-pronged, multifaceted approaches, with the core tenet that addictions are first and foremost a medical illness, chronic and relapsing. This legislation moves the agenda outlined by the working group. But first, a statistic. In calendar year 2014 in the Commonwealth of Massachusetts, there were more than 4.6 million prescriptions written, resulting in more than 255 million Schedule II and Schedule III pills in our medicine cabinets and in the hands of the Commonwealth's citizens. We must continue to focus our efforts on those who prescribe these medications. In addition to the pieces of the legislation the governor mentioned, I'd like to note the following other sections. This bill proposes to increase the education requirements for all prescribers. Currently, those who prescribe opiates may receive a few hours of training as part of their professional careers. As part of the Substance Use Treatment, Education and Prevention Act, or STEP Act, those who prescribe controlled substances will need to receive 5 hours of training every 2 years to both assist them in providing proper pain management and identifying patients at high risk for substance misuse. This bill also proposes to continue to provide primary prevention and education to parents, school personnel, and our young athletes. The bill will educate athletes and their parents and coaches about the risks inherent in opioids and the dangers of potential misuse. Specific information about opioids will be included with the already existing mandatory concussion training program that exists in our schools today, because athletes are more likely to become injured and may be prescribed strong pain medicines, so targeting this group and parents makes sense. The bill also proposes to increase the use of the Prescription Monitoring Program, or PMP, to issuing an opiate prescription. This portion of the Act would require every practitioner, including emergency room clinicians, to check the PMP prior to writing a prescription for controlled substance. The bill expands treatment options for individuals civilly committed under Section 35. Since 1987, the Commonwealth has pledged to stop the practice of involuntarily committing women to MCI Framingham for the treatment of addictions. This administration will fulfill that pledge upon this bill's enactment. This legislation eliminates MCI Framingham as an option for civil commitments for women. It also expands treatment beds by authorizing the Departments of Mental Health and Public Health to identify treatment beds available for individuals with substance use disorders. The bill also will improve access to the state's 5 recovery high schools. While these schools, located in Beverly, Boston, Brockton, Springfield, and most recently Worcester, provide safe, sober learning environments for high school students dealing with addictions, they're not fully utilized due to transportation and some other issues. The bill requires the Departments of Elementary and Secondary Education and Public Health to develop transportation plans so students can access these important treatment resources. And lastly, the bill requires insurers regulated by the Division of Insurance to file opioid management policies annually with the division. This includes the insurer's attestation that prior authorization policies to encourage safe opioid prescribing are in place, and at the same time, the policies ensure appropriate access to pain medications for those suffering from chronic pain. While this bill addresses key pieces of the opioid action plan, it's important to note that in just 4 months, many of the working group's recommendations are well underway. Some of the highlights include, since mid-June, we have added 194 treatment beds throughout the state in locations such as Dartmouth, Plymouth, Westboro, and Fall River, and another 64 beds will come online in Greenfield by December. Effective July 1st, Mass Health is fast-tracking eligibility for public insurance coverage for individuals released from correctional facilities, which is important for treatment continuity post-release. On October 1st, the Substance Use Disorder Recovery Law, or Chapter 258 for those who live in the wonky world, went into effect, meaning that all commercial insurers are required to pay for up to 14 days of clinically necessary acute treatment without prior authorization. We launched a public awareness campaign to educate about the depth of the epidemic and all of us, and particularly family members. The mass.gov Stop Addiction website has received almost 165,000 hits, and the 1-800 helpline has received just under 10,000 phone calls to date. And finally, this is just a few of the things that we've been up to. We have entered into contract negotiations with a vendor for a new prescription monitoring program, one that will have the capacity for interoperability with other states and electronic medical records. And finally, or at least for the moment, next week, as part of our commitment to transparency and data sharing, we will issue the next quarterly data on opioid overdoses in the Commonwealth of Massachusetts. This is by no means exhaustive, but a highlight of some of the many initiatives underway to bend the trend. The action plan is updated monthly and is available for all on our website, mass.gov Stop Addictions. And now it's my pleasure and honor to turn the podium to a good friend and longtime advocate on these issues, Steve Tolman.
Thank you, Marylou. Thank you very much. Good morning. I'm Steve Tolman. I'm now with the Massachusetts AFL-CIO, and I would first like to commend the committee members for all their hard work and commitment and dedication. And certainly the Secretary for her leadership, and certainly the Governor. Early on after the Governor was elected, we met on a few occasions, and we talked about the depth of this epidemic. The Governor listened, and he's taken the worst epidemic our society has ever seen, one that there is no one-size-fits-all. This is a work in progress where the executive branch has to work with the legislative branch and the judicial branch to find solutions to this epidemic. The statistics are staggering. I heard a statistic one time that said 80% of all opiates in the world are sold in one nation. What nation do you think that might be? And 80% of all OxyContin was sold in one state, Florida, because there was zero regulation if you paid cash. The depth of that epidemic from what has happened from that type of regulation is beyond our wildest imagination. Our executive branch has acted today in a forceful manner, and I know and look forward to working with them to make sure that we get an infrastructure in place to stop the heartache on every street in Massachusetts. The Governor listened. He talked about 20, 40, 60. I can tell you about 160 dangerous opiates every 2.5 weeks being prescribed by doctors for a back injury. It's outrageous what has happened. This should be the beginning of addressing the distribution problem. I look forward to working with everybody, and I can't commend the Governor enough. And Governor, you've done a fabulous job in listening. But this will not be solved by the people on the stage or even the people here. We got to uncover. We have to uncover the level of addiction, and we have to talk about it because it's nothing to be embarrassed about. These drugs are too dangerous for the human brain, and we have to be very careful when we use them. So thank you. I'm very excited about what we have here today. It is a work in progress, and we will find common ground to address the needs of the Commonwealth. I look forward to being part of it. Thank you. I have the great pleasure to introduce a doctor who has worked her heart out, has her pulse on this, from Mass General. It's a pleasure, fellow committee member, Dr. Sarah Wakeman.
Good morning. My name's Sarah Wakeman. I'm the medical director of the Mass General Hospital Substance Use Disorder Initiative, and it's been a pleasure to serve on the governor's working group. I want to start by thanking Governor Baker, Secretary Sudders, Commissioner Bharel, and Mr. Tolman. So it's an honor and a pleasure to be here today to offer my support for this important legislation that Governor Baker is proposing to fight the epidemic of opioid addiction and death across the Commonwealth. As you've all heard by now, we're in the midst of a public health crisis. Across the country, the entire U.S., unintentional overdose is now the leading cause of injury death. As you heard, across Massachusetts last year, 3 to 4 people died every day from unintentional overdoses. To stem the tide of these deaths, we need a comprehensive approach with multi-sector involvement and a willingness to think outside the old paradigms and explore bold new solutions. The Baker administration has shown incredible passion and support in doing just this. There are many steps that are needed to address this epidemic and to save the lives of the unfortunate victims of this disease. First of all, access to all forms of evidence-based treatment immediately when people need it most is crucial. We need to build a system that addresses this deadly disease the same way that we address every other deadly disease that can kill patients. We also need to ensure adequate access to naloxone, which can save a life in an immediate setting. But in addition to being an addiction medicine specialist, I'm also a primary care physician. And I know that the most important thing we can do to support health is to promote prevention. In addition to saving lives and ensuring all those that are affected by addiction get the treatment that they need when they need it most, we also need to prevent the next generation from developing this disease. One important way to do this is to limit exposure to opioids in the first place. We've successfully done this with other diseases through public health interventions. For example, we prevent diabetes by limiting exposure to foods and beverages. We prevent lung cancer by limiting exposure to tobacco smoke. So Governor Baker's legislation that allows only 72 hours worth of opioids during an initial patient encounter, except in emergency situations, will help to minimize excessive exposure to opioids, and yet still ensure that patients with pain are treated with dignity and get access to compassionate care, and that physicians can still exercise their clinical judgment in deciding who's appropriate to receive opioid therapy. Addiction is a disease that's caused by a mix of genetics and exposure. As physicians and legislators and community members, we can't do anything about the genetics, but we can do something about the exposure to minimize the risk of this disease and to try to prevent the future generation of this epidemic. So it's an honor to be here today. I'm very excited about this legislation.
Thank you, Doctor. And thank you to the members of the task force for joining us this morning and for all of your hard work. Questions for